Are you pregnant and do you feel like maybe sometimes the doctors and the nurses are not listening to you? Maybe that's something that you worry about, right? Well, then you are definitely in the right place and you want to tune in to today's live because I am going to be giving you the exact strategy that you are going to need to be able to use in the delivery room, right? When you go into labor, when you're getting ready to have this baby, to I want you to use this to feel confident, to feel empowered, and to be able to advocate for yourself. So you definitely want to tune in to today's video and get that under you so that you can be able to advocate in a way that is powerful and productive and effective. So if that is something that you are interested in learning how to advocate for yourself, hey, again, my connection got all disconnected. Um, but I'm glad you decided to join again. If this is your very first time tuning in, my name is Stephanie Poole. I am a certified lactation consultant and doula. I help first-time moms transition into motherhood like a boss. I mean, with confidence. My moms are prepared and ready. This is the exact strategy that I use with them. So I'm going to be spilling all the tea today. I am going to give you specific scripts that you can use when you're at the hospital getting ready to deliver. We are going to talk about it all. I'm going to give you the specific framework that I use and that I always teach inside of my classes so that you have what you need to be empowered enough to advocate for yourself. So without further ado, and because I've partially recorded this already, we're going to hop right in to the live today. Okay, so first up, let's talk about why women don't necessarily advocate for themselves. One of the reasons why women don't advocate for themselves is because, number one, they don't know their rights. They don't know their rights. A lot of women don't know that you have the right to refuse a intervention that does not align with your birth plan. A lot of women don't know that. Number two, a lot of women don't like being labeled as being difficult. They don't like being labeled as difficult, but I'm here to really help you and to save space for you, to let you know you cannot afford, when you are talking about giving birth, right, and delivering a baby, you can't afford to prioritize being nice over being heard. Let me say that again. When you are laboring and you are at the hospital ready to deliver and give birth, you cannot prioritize being nice over being heard. You have to be able to be very forward and get your point across. The third reason as to why women do not advocate for themselves is also because the plan for your birth has to start way before you go into labor, way before you get to the hospital. It has to start at home while you're prepping. And I'm going to address each one of these today so you know exactly what to do and how to do it. Okay? Now, I shared this statistic before, but I am going to share it again. 50% of women that's too many. That's too many. That is too many. That number is even higher for women that are of color, for minorities. Y'all, we got to do better. Part of that is having a voice. Part of that is having a plan. Part of that is being confident enough to advocate for yourself during birth. So with that being said, let's kind of take this apart and go piece by piece by piece. Now, let me kind of put some perspective on here. Hello and welcome. Part of the perspective that I am teaching from is not one to like potty on the system. Y'all, I am clinically trained. I have worked in the healthcare system for over 15 years, both at inpatient at hospitals as well as in the doctor's office. So my perspective is different than, only doing home births as a doula. No, I am clinically trained. I am in these healthcare systems. And a lot of people even question that because they're like, well, I guess I should just lead into my next point, which is, a lot of times what's surprising, especially if you're a first-time mom giving birth, is that you don't realize that these facilities are not always taking into account what your birth preferences is. That's why it's so important to advocate. Why are they not always taking it in? I don't think it's necessarily all the time intentional. Sometimes it is, but you have to remember that as a hospital, as a facility, a birthing center, they have routines, they have protocols, and in some cases, they have financial incentives to position births and the outcome of births in a particular way. So you are one person, they are a system. Another thing we have to realize is that, especially if you're giving birth in the United States, over 90% of births happen in a hospital. So while home births are a choice, right, and that's a growing option, it is not likely that most people will be birthing at home. Most women birth in a hospital. And when that is the case, we have to have this discussion to be able to know how to do this appropriately. How do we advocate? How do we have a good, positive birth experience? I have some stories I'm going to share with you today about, different clients that I've had and their outcomes, how it is possible to advocate for yourself and still have a positive birth experience. So just stay tuned because this one is going to be jam-packed with a lot of good information. Now, let me quickly say, I am going to be hitting these points and moving on because, again, I recorded this, but my connection went out. So I'm going to be hitting these points. I'm going to be dropping all the tea. But I want you to take out your notepad. I want you to open up the note app on your phone. I want you to save this video so you can come back and review it because there will be a lot of gems for you to get. And I'm going to hit them quickly and move on. All right. So I want to hop right into the framework that I myself personally use when I am helping moms to advocate and when we are coming up with a plan for birth. Now, mind you, this plan starts way before we get to the hospital. But this is the framework that you're going to use. First of all, I want you to build your plan. I want you to know what is your line in the sand. For some of my clients, that is, I want an unmedicated birth. For some of my clients, I'll use one in particular. Her line in the sand was she did not want a C-section. So that was her line in the sand. She didn't want anything that could potentially lead her down the road of having a C-section. Whatever your line in the sand is, we have to start there so we can start reverse engineering how to get there. Okay? So that's number one, build your plan. The second thing I want you to do is to inform yourself. You need to be aware of what your hospital, the hospital that you're going to be birthing at, or if it's a birthing center, what their policy and procedures are. You want to make sure that what you want, they actually offer, that they actually allow at that facility. That's important. That's important. So if you are able to take a tour, you want to take the tour and see, how the hospital is set up or how the birthing center is set up. And you want to ask questions about, do you allow, some people want to labor in water. You want to ask, do you allow that? Is your facility set up to accommodate, water births or water labor? These are all things you need to know before you go into labor, and you need to be very clear about it. If they don't necessarily have tubs for you to be in, perhaps they have showers for you to stand under. So you need to talk and make sure that, okay, I have a clear understanding of what their policy is about water labor. I am allowed to labor with some sort of water therapy, but it's not in a tub. All of that needs to be clear right from the beginning. So I want you to build your plan and to be informed. Know your rights. What is it that is allowed as far as interventions? And when I'm talking about interventions, I'm talking specifically about anything that will be used to, from a medical standpoint, to help you to labor or to give birth. And so an intervention could be anything from pain medication to an epidural to forceps to whatever. That is what an intervention is. And so you need to understand what interventions, does this particular facility allow and which ones they don't. Okay? The next thing I want you to do is have a role play or go in your mind, right? And I want you to figure out how this scenario is going to play out. And the reason why is because there might be friction there. And if you and I'm not just saying like by your provider, it could be a nurse that's on shift that day, right? It could be whoever part of the medical staff that's there. That you come in contact with. And maybe your birth plan says, I want to labor unmedicated, but you have someone coming into your room suggesting, some type of medication for relief. You need to have in your mind how you're going, what that looks like. What are you going to say? I want you to practice it before you need to actually do it. The reason why I want you to practice it is because if you get into the practice of saying, hey, I have already determined I want to labor without, medication, it will roll off your tongue when it's time to actually implement that. So you need to have we call it role play scenario, but I want you to play it out in your mind how you plan to respond if certain things are suggested to you that is outside of your birth preference or your birth choice. Okay? The next one is to team up with a support person. Now, I'm not just saying this because I am a doula. I'm saying it because we know that investing in a doula to be part of your birth team oftentimes will result in a smoother labor, a more natural labor, and better birth outcomes, right? That's not my opinion. That's research. But even if you are not able to, maybe you can't, I encourage you to extensively look for a doula for support. But let's give the scenario, maybe you live in an area where there's not a lot available in terms of doulas. It's okay. Just grab whoever is going to be there to support you and make sure that you guys are partners. Make sure that they understand what your birth preference, what your birth choice is. And also, let me give you this as an example, because this is a very powerful nugget that will be helpful when I'm saying, partner up with someone in your birth support team. Become a partner. Okay, let me tell you what that looks like in real life. What that looks like is, as a doula, one of the things that I do is, if a mom, let's say she comes to me and she says, I want to, have an unmedicated birth. At that point, we come up with what would be determined as a safe word. It could be something like peanut butter, okay? So the plan is this: we are going to labor without medication, and you, as the pregnant mom who is laboring, is going to hold on to that word. That's your word of empowerment. And I, as your birth support partner, I'm going to support you for as long as I don't hear that word, peanut butter. But the minute you feel, I'm not going to suggest any pain medication. I'm not going to suggest any interventions. I'm not going to suggest, we're just going to naturally labor and naturally allow that process to move forward, right? But if you feel like you need to make a pivot, maybe it's been a while and think you're feeling like, I don't know if I have the strength to move forward in this. It could be that the status, your stats, your blood pressure, things like that start to change, or that may change for the health of your baby, and you need to make a pivot for whatever reason. Then you would use that safe word, peanut butter. And at that point, that triggers me to know, as your support person, okay, we are making a pivot. Let's get some pain relief coming in. But I don't suggest it without hearing that. Why is that such a powerful tool to use? It's a powerful tool to use because sometimes if your support person is watching you, they're on the outside, right? They can't really feel or understand how you labor. And you moaning and groaning and, being intense or crying, that may just be the way that you handle pain. That may just be your coping mechanism. But for someone on the outside, they may start to wonder, oh my gosh, are you sure you don't need anything? And what happens is every time someone suggests, right, this thing that you originally did not necessarily want in your plan, it starts to plant a seed. And so we don't want to plant the seed. We just want to give you the power to use that for us to be able to make a pivot if we need to. Very, very powerful tool. Please use that because it is recommended to actually help get you to the birth that you have desired and chose. Okay. So that's what it means. That's what it looks like to become a partner with someone on your support team, because they will know, okay, she's okay unless she uses this particular word, that safe word that we talked about. So that is what that looks like. The last part of this particular framework is to have a backup plan. And I'm going to share in just a second a particular story of a client that I had where this actually came in handy. Actually, a lot of components of this framework came in handy. But I want to talk briefly about having a backup plan. That is so important. It's important to have a backup plan because a backup plan gives you choices. It gives you choices. So you don't necessarily feel like it's all or nothing. It's the same way with like weight loss, where at the beginning of the year, everybody is on a weight loss journey, right? And if you say to yourself, I'm never ever going to eat a piece of chocolate or sweets again, you kind of box yourself into a corner that the minute you have a piece of chocolate or sweets, maybe Valentine's Day is coming up and you have that, then now you are feeling as if you didn't meet your goal. But if you have some choices, right, some healthy choices as options, then you still have some room to meet your goal and still have some sweet treats in the meantime, right? It gives you options. The same is true for having a backup plan for your birth preference, for your birth choice. So really quickly, let me just kind of do a quick recap. Make sure you write these down. You need to build your plan. Make sure you know what your line in the sand is when it comes to delivery. What is something that's very important to you to be able to consider yourself having a successful delivery? You need to know that up front. Inform yourself. Know the rights that you have to be able to understand what that facility allows and what is not allowed at that facility. You need to know that before you go there giving birth. Have a practice the scenario. Next up is partner with someone in your birth team. I use the example of having that safe word. That's very important. And lastly, have a backup plan, which gives you options to still have a successful birth. Now, here's where I want to kind of share the story of one of my clients who, her line in the sand was she did not want to have a C-section. She was open to having some pain management relief, but she wanted to try and labor as much as she could without it. But her line in the sand was she did not want a C-section. And so the context that I need to put around that is that she, by the time so this was a plan that we had worked on prior to her going into labor. And by the time we made it into labor, um, it ended up being an induction. And so I can talk about that more specifically in a different video. If that's something you want to learn more about, then definitely comment the word induction below in the comments, and I'm happy to oblige. But for the sake of this conversation, she was induced. And to know anything about induction, it kind of forces your body into an active state of labor so that you could go ahead and deliver. So that was the context of what we were working with. And she did not want a C-section. So she started to labor. The induction is working, but it's a little slower than the anticipated time of when they expected she should have progressed to by this particular time. So the doctor came in and gave her some options on different interventions that could be possibly used to help progress the labor. What we did was, after those options were explained to us, then I stepped in to help her advocate, and I said, thank you so much for letting us know about these interventions. We need a moment to be able to review. I want to make sure that my clients understand fully what each intervention is, and then we'll make a decision from there. So that's, you got to pay attention to this, right? This is how I want you to advocate when that time comes. Just because they are suggesting it doesn't mean you have to give an immediate yes. That is not what we did. We slowed it down. We reviewed the options to know, okay, what is okay, what is not okay, what are the benefits, what are the cons of each one. She made a decision after presenting all of the information to her. She made a decision to go with one of the interventions over the other one. She did not get the second intervention. That to her was not something she wanted to do, so we didn't do it. And she was able to continue to progress, and I am very happy to report that she was able to still have a vaginal birth, which means she met her goal of not having a C-section. So my point is this: you got to be able to have certain things in place. This framework works. If you are using this framework that I just gave you, it will help you as you start to labor to be able to make choices and decisions on your behalf when it comes to delivery. And that's important. That is important. Now, I also want to quickly talk about or give you specific phrases that you can use when you are advocating for yourself if you feel like you're having any friction or pushback, okay? And these are not phrases that are just thrown out in the air. These are phrases that I have literally used when I am supporting a client, okay? So the first phrase that I want you to be able to use, let's say, just like in the scenario I just gave where, you're laboring and they're like, well, we want to try and see if we can get you to progress a little bit more. We have this as an option. They're presenting an intervention for you. It may be to put some gel to help, open the cervix, or it could be to use an inflatable balloon, or, whatever they're presenting to you. You can say, and let's say when they present these things, you're not okay with something that they have given as an option. You don't want to use one of those interventions. You can, if they're saying, hey, no, you have to do this, because oftentimes it is positioned in a mandatory way, you can say, can I see the policy on that? Can I see your hospital policy that states that I have to have this procedure? We're not saying it with an attitude. We're not saying it, in a nasty kind of way. We're just being very matter of fact. And if they're presenting information to you that you are not 100% aligned with, I want you to just simply state, not in a nasty way, I just want you to simply ask, may I please see your policy that states that I have to have this particular procedure? We're putting the ball back into their court. We are making them accountable for what they are presenting to us. Okay? That's number one. That's the first phrase. Write that down. The second one is, I'd like to discuss the risk and benefits before deciding. That's exactly what I told you, how we presented it to the physician that was bringing up these interventions with my client. I said, okay, thank you for this information. We'd like some time to be able to review it before making a decision. They were like, absolutely, I'll be right outside the room. Just let us know. And they gave us the privacy to be able to discuss those options. And she was able to resolve a option that she felt okay with without them standing there looking at her, waiting for an answer right then and there. So that's the second one I want you to use if you need to advocate for. The last one is to be able to say, just simply, I don't consent to this intervention. I don't consent to that treatment. Okay? So if it's something that you are fundamentally against and they are asking you to, implement in your birth, maybe it goes against, your philosophical beliefs, your religious beliefs, maybe it's something that you just absolutely, feel very strongly about for whatever reason. I want you to just simply say, to understand that you have the right, even if they position it as mandatory, you have the right to refuse medical interventions. And you are able to just simply say, I do not consent to this procedure, to this intervention, whatever the case may be. Those are very simple things, very easy to remember, easy to make notes on. Like I said, I would even open the app, the notes app in your phone, and have this with you on your phone, just as, a brief review in case you end up at the hospital and you're like, oh shoot, what was that? You'll have it right in your notes app. So be sure to save this video and come back to it if you have not already made those notes, because they are simple and yet they are effective and powerful. Medical people, I have used these, they hear it, they understand it, and they get it. They get it. These allow you to feel seen and to feel heard. Now, the number one way, right, to advocate for yourself is to be prepared. And the way that you can be prepared is by learning this information up front. So if you enjoyed today's video, if you found value in today's video, then I encourage you to take a look at the link in the description, because there are other resources and classes available that you can use to empower yourself for a more confident birth, right? By being prepared, by having all of this information in your back pocket as you move forward. You do not want to be in a situation where doctors and nurses and medical staff are talking over your head. You don't want to be in a situation where you are not familiar with the birthing process, what to expect, how it happens, what labor feels like you don't have to be in that situation. There are resources and classes that are available in the description box below. Another way that you can work with me besides taking one of my courses is to book a one-on-one intensive where you get a personalized plan. We do a deep dive, me and you, and we get you all ready based on whatever is the most concerning. So we can do it in regards to birth plans. We can do it in regards to laboring. We can do it in regards to postpartum, if you want to plan and set up your postpartum, or we can do it in regards to a deep dive on breastfeeding. But that link is below as well if you are interested in doing either a one-on-one. And if nothing else, like I said, there are classes and resources available in the description box. But that is part of being empowered. It's just simply information. Knowledge is power. And to have a certain level of knowledge on this particular topic. So with that being said, I hope that this was helpful, because I feel like it's just huge in terms of being for all women, but women of color that, you know, have a lot of things going on or presented to them that is simply not needed. Remember that statistic was 50%. And so we want to get that down. We don't want you having unnecessary interventions. Once you know how to advocate for yourself, it is one of the most powerful things that you will be able to use, not just in this pregnancy, but in pregnancies, future pregnancies, as well as other areas of your life. It's always important to know how to advocate for yourself, especially as a woman. I hope you found this helpful. Thank you so much for joining me today. I will see you in the next video. Bye.